Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Today we're discussing the many myths surrounding childbirth, labor and delivery, and every expecting mother has heard at least one, myself included. So here to help us separate fact from fiction is top New York City OB-Gyn and Director of Gynecology at Roosevelt Hospital, Dr. Jacques Moritz. Let's start right off the bat with epidurals. The big myth is epidurals slow down labor.
I would say that I would try to avoid getting an epidural at 1 centimeter. That means at the first contraction, maybe you don't want that epidural.
That's easy for you to say.
Well, of course, I've never had that one contraction, but
okay,
I think
and why is that?
Well, even though the studies show that it doesn't really slow it down, it's probably better to get into labor to soften up the cervix so that you don't need to get Pitocin and other kind of interventions. So I'd wait till you at least feel some labor, say, that's it, I'm throwing in a towel, and get the epidural. And there's nothing wrong with getting the epidural. You're not a failure, you're not a bad mother.
You don't
you're
get
not
any
all these
extra
things.
points.
No, you don't get. In our hospital, you don't get a little medal.
Eating during labor. Now, I think I know what you're going to say.
Oh boy.
One of the myths is that it's dangerous, that you shouldn't do it, it's a life or death thing. We know that our anesthesiologist colleagues, they don't like it. Other people say, look, this is like running a marathon. You need your energy.
Right.
Before we checked people into hospitals, people were at home, they ate during labor.
Let the patient decide if they want to eat or not.
Right.
If you're going to be induced and you're going to get this Cervidil and you're going to be there for 24 hours, it's cruel and unusual punishment to not be able to eat. Now, if you're really huffing and puffing and I came to you with a gourmet meal, you would throw me out of the room and the meal and say, get the hell out, I don't even want the smell of it.
Or eat it and throw it right up.
Yeah, you would, because the natural thing when you really get into labor, if you're not having an epidural, is to empty your stomach, just like marathon runners. You see them off on the side, and when they really hit that wall, they're like, bleh. So, and that's okay. We deal with it every day. But I would talk to your doctor before and say, listen, I'd like to be able to drink. I don't want to be really restricted in what I eat or drink.
What about the myth of IV versus no IV, and how much IV fluid do you think is helpful or hurtful in labor?
Well, in terms of the IV fluids, the first thing is, do you really need this IV? Now, it really depends. If you're coming in with a previous C-section, if you have a placenta previa, if you're at high risk for having a C-section, you better get that IV in. Twins, you better get that IV in early versus than late. Now, if you're trying to do this au naturel and everything, that's the one thing that people don't want, is they don't want to be tied down. They don't want this around them. They want to be able to walk and move. I've seen some studies where if you get too much fluid, it kind of spaces out the contractions. So I think it's a judgment call. It's one of those things where the minute you walk in, the nurse is trying to put in the IV, there's people that need it, and it shouldn't be right away automatic. The idea is to have it there in case of somebody needing a blood transfusion. The chance of a blood transfusion is pretty small.
Pretty low.
It can usually be figured out on who is going to need it.
So individualized.
I think so.
Okay, now what about breaking your water?
Oh, that's a good one.
Now that is a good one.
That's
and let me tell you, I had my water broken.
And you loved it.
That's painful, but
I didn't do it.
You didn't do it.
It wouldn't have been painful.
It's painful. But I believe it does accelerate labor. It does get people going. You trained me from my first day as an intern. Break your water.
Right.
What do you think?
Well, I think, again, this is really selective. If somebody's out there watching and it's their first baby, I'm not so certain I said go in and break their water right away. And I think the studies have shown that first-time mothers breaking the water really early, that may actually make things worse. Okay. Second-time mothers, there's no doubt about it. If you break the water, that pain's coming, and you better get ready for it. It's going to be like a train
an
leaving
explosion.
The station. It is going to be
train leaving the station.
It is with a second-time mother, but a first-time, it's hit or miss.
Would you consider it true to say it's a natural way to get labor going?
It can be a natural way. The problem is, it's again with this obstetrics, it's such a judgment call.
Right.
When do you do it? If you do it too early, you're just setting yourself up for infection. If you do it kind of in the middle when things are already going, I think it's going to speed it up. I think you've probably seen that too.
Yep. So it's, again, individualized. It comes down to the art of practicing obstetrics. What about Pitocin? There's a big myth there that Pitocin is more painful than natural labor. I've heard a lot of patients, I know you have too, say, I don't want Pitocin. It hurts more than natural labor. You think that's true?
I think that's true. I don't know if that's a myth. I think that
really?
Yeah, because I think the natural contractions start slow, get up to a peak, and start going down. And the Pitocin, when you really get it cranking, as we say, Those contractions coming every, they come out of the blue. They just boom and they go away, and they boom and they go away. I think, now you're going to get my opinion on this, I think getting Pitocin without an epidural is cruel and unusual punishment. That's my idea.
And you're not cruel.
Oh, well.
We're going to take a quick break for a word from our sponsor and be right back with more labor myths and Dr. Jacques Moritz after the break. Okay, so you've gone through the whole labor. You're ready to push.
I'm tired
Not
already.
You.
I'm tired. I don't know if I can do this.
And baby's crowning.
Yes, baby's crowning.
Episiotomies, myths versus truths.
I think that you shouldn't do it unless absolutely necessary, but it's a judgment call. This is the big one. If you don't do an episiotomy and you the patient, have tears all over the place.
We call it a grenade to the
We do
perineum.
call it that. I was going to avoid that word.
A
But
blowout.
Yeah, a vaginal blowout.
That's right.
You're going to wish you had 2 episiotomies.
Right.
Now, that's, of course, coulda, woulda, shoulda, which I hate in obstetrics because there's never right or wrong.
Hindsight is 20/20.
It is. There are certain conditions that I think you're going to get an episiotomy. Number one, if the baby is ready to come out and the heart rate is down and it's been down and the only thing holding that baby from coming out is doing an episiotomy, do it. Number two, if you see the vacuum, and we hardly do forceps anymore, but if you see the vacuum coming, usually I would say that it's really hard to do a vacuum delivery without ending up with a lot of tears. Better to do an episiotomy. If you think the baby is going to be ginormous, 9 or 10 pounds.
And we're going to have to dive in to pull the baby out.
Right. It may be better to do an episiotomy. The rest of the people probably, if everything goes well, can avoid episiotomy.
Now, so the baby's out.
Baby's out.
We have
Can I go home now?
No.
Oh.
We're still, the baby's in my hand.
All
the
right.
umbilical cord is still attached. A big myth is the doctor or nurse should not cut the cord. It should stop pulsing on its own, and that is better for the baby.
I love that one. Now we're going to bust that myth.
Bust it.
Right here, right now.
Tell me.
This idea that tell the doctor to stop the cord pulsating is the craziest thing in the world.
Completely.
So the baby's out. The cord's there. It's exposed to air. The air is going to cause it, and temperature. It's going to cause it just to squeeze all by itself.
That's
and this idea of waiting till the cord starts pulsating, I can't even feel the cord pulsating.
That's right.
And everyone's screaming, wait for the cord, wait for the cord. I said, listen, guys.
And also, we tend to hold the baby a little bit below the mom. The baby can get a little too much blood back to the baby,
That's
right?
true
in some cases.
Right. So this is classic myth. This is just going old wives' tales.
What about the myth, and this is our last one, if you've had a C-section, there's more difficulties bonding with the baby than if you deliver vaginally.
You have a lot of time to bond with that baby. You got a lot of time.
That baby was inside for 9 months.
Exactly.
2 minutes,
Exactly.
whichever way it comes out is not going to change.
Right.
Thank you.
No
I feel
problem.
so much better now. We've dispelled all these myths.
I'm exhausted.
Busted them.
I'm exhausted.
We feel like we've been in labor.
I am in labor.
And thanks for watching another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health, and please join us next week for another episode of Health and Wellness featuring Dr. Jacques Moritz, this time talking about C-sections.